Okay, so now we're going to take a look at Dr. Wondrowski's left elbow that actually does have a little bit of fluid within it. So her position is going to be at 90 degrees. Her elbow is going to be at 90 degrees. We're going to take a longitudinal view of the back of the elbow. So reference end is going to be proximal up towards her shoulder, and non-reference end is going to be anchored on the olecranon right here at that bony prominence. So I'm going to put my probe on top of there, and then we'll see this image here. And then let me get into position. I'm trying to make the bone as crisp and clean as possible to try to standardize my image across not only one patient, but multiple patients and multiple providers.
And we can even get an interface. Yeah, let's, you know what, Peter, get that interface sign again, and then I'll freeze. Okay, we have an interesting finding here. So yeah, I have fluid everywhere because I have arthritis, but again, no pain. And this is a very small amount of fluid. It's almost physiologic because you can see that the fat pad that fills that olecranon fossa is not displaced. It's well within limited to the joint space here underneath the triceps tendon. And so if you had a real bad bleed, that fat pad would be displaced to the top. However, how do we know that this is fluid? Because sometimes in this position, it's a little hard to compress, especially in bulky muscular guys with a big triceps. There's an interface sign. This is this fine line here separating the cartilage from the bone. If the probe is in absolute perpendicular position to the bone, it will separate the cartilage from the fluid on top. And you can see it's very hypoechoic and echoic fluid. In the case of a bleed, this would be speckled and grisly and echogenic.
And you can see here as well, we see the olecranon process here of the ulna here. And then we see the distal end of the humerus. So right in here is the joint space. So when fluid or a hemarthrosis is present, it's going to present like this, where it'll start to come out over the top of this hump of the distal posterior aspect of the humerus, and then kind of just waterfall down into this fossa, the olecranon fossa here, and occupy this space.
And in my experience, this is the money shot, quote unquote. This is the easiest position to see bleeding or fluid, but we have two more to show you. Anterior, short axis and long axis.
Okay, so let me get some of this one. So we are going to show you the anterior elbow in short axis. Reference end is going to be lateral, non-reference end is going to be distal. The patient's going to be in near full extension, or as extended as possible at the elbow, and you're going to go right into the cubital fossa here. And again, we want to try to make this bone as crisp and clean as possible. We're going to see this hallmark sign of the distal epiphysis of the humerus, which is kind of the scalloping contour of the humerus here. Again, try to standardize that image by making that bone bright and white and crisp. On top of that, similar to the ankle in short axis, in anterior ankle short axis, we see that bone or the cartilage that's sitting on top and lining the bone. Then we see this other bright white line that's sitting on top of the cartilage that kind of mimics the contour of the bone, and that is your joint capsule. Everything above, superficial to that joint capsule, is muscle. So we see her brachialis muscle, we see some muscles over here, and then we see her brachial artery, which I think is probably this one. I'm not sure. We would need to go back to a live feed and see that. But the area of interest here is going to be this down here. So when you have a hemarthrosis or any kind of effusion in the anterior part of your elbow, it's going to be sitting right on top of this cartilage. And this joint capsule is going to be suspended or pushed superficially. So it is going to be occupying again above this cartilage. And sometimes, as we saw in the posterior elbow, you'll see an interface sign that's distinguishing and demarcating between the cartilage and the fluid that's sitting on top of that cartilage.
And this is the last position if you haven't detected it yet.
So last position of the elbow, your reference end is going to be proximal up towards the shoulder. Non-reference end is going to be distal down towards the hand. We're going to be ultrasounding the humeral ulnar joint. So that's going to be our humeral radial joint, which is going to be pushed laterally. So we're going to bias it, not completely midline, but we're going to bias it a little laterally. And we are going to see the humeral radial joint here. And that is perfect. So we're looking, left side of the image is proximal, where my reference end was. Right side of the image is distal, down towards her hand. We see the humerus here, the distal humerus, the anterior distal humerus coming up and down, making that hump. Then we see the radius here, the radial head here, bright, white, crisp, clean bone, and going off distally. And then we see this cartilage, the same cartilage that was lining in the short axis view, lining the distal end of the humerus. We see catch a little bit of cartilage on top of the radial head, and then we this, which is the joint space of the humeral radial joint. Then we see this bright white line, kind of looks like a little tornado going into the joint space. That is called, that is your joint capsule there, and soft tissue that's kind of within the joint capsule or kind of mixed in between. And so we want to see this V, or this tornado that's kind of coming down into the joint space. If we see this V kind of pushed superficially, that means that there might be an effusion there. Again, would kind of occupy this area. Sometimes it even spills down over to over here, and we actually see a little bit of an effusion, just a tiny bit. Sometimes it collects there. Sometimes it collects proximally up towards the radial fossa of the humerus here. But more often than not, it'll collect down in this distally down towards the radius as gravity kind of pulls fluid down distally. And again, just trying to keep your bone nice and crisp and clean, and a hemarthrosis would kind of occupy this space and maybe even spill over distally.
Here, and might sort of displace that synovial capsule to the top, all fluid filled.